The public health sector is celebrating another medical milestone despite the many challenges that it still faces. For the first time in 40 years, a team of surgeons at Sebokeng Hospital's new neurosurgery unit have performed brain surgeries on 2 patients with hematoma. For more on this, let's bring in the hospital's acting CEO, that's Dr. Fhatuwani Mbara, who joins us via our telephone line this morning. And Doc, it's great to have you on the program. Thanks so much indeed for speaking to us. And yeah, it certainly is a good news story, right, in the midst of the many challenges we face. Let's speak firstly about this new unit at this particular institution and the kind of things that you're hoping to achieve there.
Yes, good morning to yourself and the viewers. Thanks for having me. Today, I think it's a very great milestone for us as a district of Sebokeng to be sharing our great milestone with the rest of our country. We're very happy. It has been a mammoth task for us to start the unit. There had to be a lot of work that needed to be done on the ground level to then fast track this new unit. It was a much needed service because the statistics have shown us that we're losing a lot of young patients due to unavailability of beds at our tertiary institutions where these procedures were being operated, mainly at the Fhatuwani Mbara Hospital.
Right, and we'll speak about the kind of impact this has had on reducing that load in a while. But, you know, you mentioned young people, for instance. I understand one of the 2 patients that you're able to perform this brain surgery on was actually a 4-year-old. Yes,
our patients, they are fairly young because you understand that trauma, mainly with a high level of MVAs, motor vehicle accidents, occur at the young age, ranging between 20 to 40. These are the patients that we're losing. But also due to organic causes that are medical related, not necessarily trauma, they also impact on the level of strokes. So the young patient that we operated, indeed, one was due to trauma and then had cerebral bleed. And the other one also, it was out of accident, what we call the vessels have just bursted in the brain, so out of organic causes, not necessarily because of trauma. So it was a young patient, indeed.
Yeah. As I mentioned, you're treating them for subdural hematoma, which sounds incredibly technical. I wonder if you're able to break down for us what this procedure actually entailed. What was the, I suppose, challenge that you were faced with, and what did you need to do to try to fix it?
Yes, as the name says, subdural. So it's the bleed that occurs under a layer called the dura, which is found in covering the brain. So the vessels, they burst there. On the other one of trauma, it's because of the impact of the trauma, then the bleed occurs, and then they had to perform what we call craniotomy. And on the other one, there was also they had to do a cranioplasty, whereby they have to fix the cranial structure so that it gets aligned to the skull, to correct the deformity of the brain, of the skull. Sorry. So it is one of those procedures that neurosurgeons always perform. It's just for us, because the new unit, it is a big achievement because we've never done that before.
Yeah. How long did the surgery take?
Approximately 2 hours. You know, neurosurgery cases, they can go on for hours and hours because these are very delicate procedures. And but for this one, it was roughly around 2 hours each. Yes, and the surgeons did a great job.
Yeah, and I suppose that answers my next question. How are the patients doing? Do we know?
Yes, we have managed to make follow-up on our patients because they've been discharged. And now they're just complaining of minor pain there and there, but they've been given medications to take at home. So they're doing quite well. So they've come to our clinic to see our neurosurgeons for review, and we're quite happy to report the progress. of our patients. So
Yeah.
it is a great milestone for us to celebrate as the district of Sebokeng and Sebokeng in particular.
Of course. You know, this conversation is taking place notwithstanding the many challenges that specifically Gauteng Health actually faces. One of them was the fact that before this unit was opened, you had also mentioned that all the patients had to be redirected to Fhatuwani Mbara. To what extent, or let me ask the question differently, do you know how much of a relief this has now become for Mbara, now that people can essentially come to you too?
Thank you very much for that question. I think that's the cornerstone of this milestone, because we had to look at the statistics. There were a lot of presentations that had to be done between Baragwanas and ourselves, indicating the statistics. And then one Professor Oma, who is the head of Department of Neurosurgery at West University, alluded to the fact that Fhatuwani Baragwanas is overcrowded. In most of the cases, the ICUs are full. And then he managed to establish neurosurgery unit next door, Telemukaran, and then he was just waiting for Sebokeng to ring a bell for him, then to start facilitating the process. And then we also looked into our stats. We realized that most of our patients, they remain in our ICU for long with no definite plan, because we found that at Fhatuwani Baragwanas they are full. Then hence we came to the conclusion to say that the Sebokeng district, which has roughly 1.4 million people, they need their own, whereby we need to relieve also the transportation from Sebokeng to Baragwana, which is roughly 45 minutes. We can rather capacitate ourselves in-house and then do these procedures.
Yeah, absolutely. And hopefully you'll be given the support to continue doing the great work that it looks like you're able to do. For now, thanks very much for speaking to us. Really appreciate your time. Dr. Fhatuwani Mbara, who's the acting CEO at Sebokeng Hospital, where they've been able to perform their first neurosurgery in 40 years at that institution of their new unit, what opened. Once again, Doc, thanks for your time.